Assalamu alaikum, respected expert panelists and learned audience. My study is comparative study between the Imprint cytology and frozen section biopsy for intraoperative assessment of sentinel lymph node in breast cancer. Here is the author, my mentor, Professor Sonargaon Madam, and I am presenting Dr. Noor-E-Alam this study. Breast cancer is the most frequent diagnosed life-threatening cancer in worldwide. In 2020, about 680,000 women were died in breast cancer. In less developed countries like ours, breast cancer is the leading cause of death. But in developed countries, lung cancer is the leading cause. Treatment goals include controlling the disease, improving survival, reducing the metastatic risk, and restoring the quality of life. Treatment modalities of breast cancer include surgery, radiotherapy, systemic therapy, and targeted treatments. Surgery remains the mainstay of treatment of breast cancer. Sentinel lymph node is the gold standard surgical staging for axilla in breast cancer, and that reduces the unwanted second surgery. Various cytological techniques such as the Imprint cytology offer rapid intraoperative evaluation of tumors and surgical margins. Imprint cytology was utilized in 1927 and remains a reliable technique in the diagnostic accuracy. Frozen section biopsy provides results within an hour and allowing immediate feedback during surgeries and influencing surgical decisions. This study is comparing the sensitivity and specificity of Sentinel of Imprint cytology and frozen section on same Sentinel lymph node of breast cancer cases operated in Dhaka Medical College Hospital and two different private centers in Dhaka, that is the Central Hospital in Dhaka and Padma Specialist Hospital. In approximately about 70% of early breast cancer cases, axillary lymph nodes are not involved. Unnecessary axillary dissection can lead to the complications such as the seroma formation, lymphedema, and frozen shoulder. In Bangladesh, intraoperative assessment of sentinel lymph node is primarily done through the frozen section biopsy. While histopathology remains the gold standard for final diagnosis, it may cause delay in treatment decisions. Frozen section biopsy is not widely available in all healthcare facilities in Bangladesh, but Imprint cytology can be performed in any pathology lab requiring only some basic logistics. Our research question was, is Imprint cytology inferior to the frozen section biopsy? Our general objective was to compare between the Imprint cytology and frozen section biopsy for intraoperative assessment of sentinel lymph node in breast cancer. And the specific objective was to see the Imprint cytology and frozen section biopsy of sentinel lymph nodes and to assess the sensitivity and specificity of Imprint cytology and frozen section biopsy of same sentinel lymph node. This was a prospective observational study and was conducted in the Department of Surgery in Dhaka Medical College Hospital and two different private medical centers in Dhaka. The study period was 1 year. Our sample size was 95. We have included the breast cancer with negative lymph node in pre-operative assessment, and we exclude the patient that have the positive axillary lymph node and recurrent breast cancer. This was the variable, that is the KNE staging, histopathology, receptor status, type of surgery, Imprint cytology of lymph node, and frozen section of lymph node. Most of the patient was in T2 stage, and most of the histopathology report was infiltrating ductal cell carcinoma, and most of them were in grade 2. Most of the patients were in luminal B. We have performed different types of responsible surgery and mastectomy. But among them, 29% patients we have performed axillary clearance, and that is the 71% patient we didn't perform axillary dissection because the sentinel lymph node and frozen section biopsy of the sentinel lymph node was negative. There is a correlation between the sentinel lymph node evaluation by imprint cytology and frozen section biopsy with final evaluation by the paraffin section. Here we can see that in case of imprint cytology, false positive was 3 cases and false negative was 3 cases. But in frozen section biopsies, false positive was 3 patients. The diagnostic performance of axillary lymph node metastasis detection showed that imprint cytology showed 88.46% sensitivity and 95.59% specificity, while frozen section demonstrated 100% sensitivity and 95.59% specificity. Here, the specificity of the imprint cytology and frozen section biopsy is same. Now we can conclude that imprint cytology is a viable alternative while frozen section equipment is unavailable, especially in underdeveloped or rural setting. It is simple, cost-effective, and accurate, particularly with an experienced cytopathologist. It enhances intraoperative diagnosis without complex machinery, making it ideal for resource-limited hospitals. Our limitation was that we have different pathologies in various medical centers that has impact on our result, and we have used single dye in sentinel lymph node detection, that is methylene blue. And presenting my gratitude to Department of Surgery, Dhaka Medical College Hospital, Bangladesh Specialist Hospital, Central Hospital, and Department of Pathology in Dhaka Medical College Hospital and Bangladesh Specialist Hospital. Thank you. Thank you very much.